We will go through the second project, and then we'll come back for questions and everything that relates to that. I want to say that the next project has to do with the media coverage of COVID-19, something we went through, and the issue of vaccines. And mass media has had an enormous impact on public attention and attitudes towards COVID-19 and later on its vaccines. The presenters of this topic will speak about the spread of misinformation regarding this phenomenon and introduce a guideline to follow to avoid fake news. The project team of students of the task force that worked on this project is Ani, Alexander, Gevorg, and Artio. The microphones are yours.
Thank you. I'm going to share the screen right now. Please let me know if you see it.
Yeah, we see.
Okay. The topic we have chosen is COVID-19 and the vaccines and how they have been covered in media. The reason we wanted to talk about this is because it's a very recent topic, a recent thing that happened to us, and the mistrust that has been built is quite huge. So let me introduce the team. We are 4 undergraduate students. Artyom is majoring in business. I'm Gevorg, majoring in engineering. Ani is majoring in English and communications, and Alexander is doing his bachelor's in data science. Now, I want to talk about the social dilemma. There is a Netflix documentary that's dedicated to the impact of social media to our lives, and it touches different topics of what have we become, how addicted we have become to the social media. I want to quote a part from the movie, which you're also seeing on the left side of the screen. The speaker says, Facebook discovered that they are able to affect real-world behavior and emotions without ever triggering users' awareness. They are completely clueless. Fake news spread 6 times faster than true news, and we're being bombarded with rumors. This is such a big problem because in social media, people have the right to share whatever they want. And we have this community of friends and news that we like, and they post constantly, and that's what we see in our everyday basis. The addiction is one of the biggest problem as we wake up every morning having the need to check out our phones and see what the news are showing. These news, some of them are fake, some of them are true. One of the biggest problem is that we're reading only the header, but not what's the rest of the thing. The visuals of the COVID-19 have been very well made, and they attract attention, and they make people want just get an idea about what's going on. And sometimes these are myths and fake stuff that have nothing to do with reality. In this case, some people have come to a point when they start to hesitate. To give an example, one once decides that he or she is going to get vaccinated, and on the way to the hospital, they see a news on their Facebook page that says the vaccine has microchips in it. What happens is they start hesitating and they think that, oh, maybe I shouldn't be vaccinated. So in this whole world of so many sources talking about the same thing and they all talk differently, there is a difficulty of knowing which one should be trusted. These are some myths that Healthcare of Armenia have made a website and put it there, and they're trying to demonstrate and show that this is not true. Myths like vaccines include microchips, that their effects are really bad, or if you got the COVID-19, you don't need to be vaccinated anymore. Or if you have a good immune system, you will handle the virus and you won't need to be vaccinated at all. Let's look at some data. So just want to let you know that the new cases for the past 24 hours have been 566,000. The total cases of COVID-19 so far till May 3rd are 512 million. 607,587, and the total deaths out of which are 6,243,038. And out of this much, only 4.6 billion people have been vaccinated, fully vaccinated. This is only 58% of the world's population. If we look at Armenia, in Armenia, 422,000 cases of the COVID-19 has been recorded, and the deaths have been more than 8,000. And people who have been vaccinated are 996,000. We haven't even passed the limit of 1 million citizens of Armenia. So a very big question raises, should we trust the media? Should we trust what we see there? And we are here to answer that question. And Alexander now will continue.
Thank you, Georg. Now I'll talk about the diagnosis of trust problems. Due to the increasing number of infected people, the crowds were exposed to the panic of the unknown, thus being vulnerable to scams, fake news, and conspiracy theories imposing fears and uncertainty. Fake news relating to health issues are usually driven by society's lack of scientific knowledge. For example, we had to deal with misinformation about the coronavirus spike protein and its ability to cause COVID, reach the brain and cause clots or disease, or be transmitted from one vaccinated person to another on several occasions. Such fake news is based on a misinterpretation of scientific findings and can even be shared by people claiming to be scientists or even by scientists themselves. Another example is the claim that COVID vaccination may induce infertility because of a short amino acid sequence, and there is no scientific evidence supporting this. Such kind of information creates trust problems relating to the news in healthcare. According to a recent study by Oshinsky in 2020, believing and trusting in virus conspiracies is linked to a proclivity to disregard information from experts. Freeman 2020 wrote in his article that he found a correlation between believing in COVID-19 conspiracies and increased vaccine apprehension. People who believed that the virus was bioengineered, for example, were less inclined to follow public health recommendations, such as staying at home, and were less likely to receive the COVID-19 vaccination. One interesting finding is that fact checks propagate more slowly on social media than misinformation, rendering fact checking ineffective on its own. According to a Politico investigation, Facebook's fact-checking measures did little to prevent coronavirus conspiracy theories from spreading rapidly in private Facebook groups. Misinformation's continued impact effect asserts that people may continue to accept it even after it has been disproved. And again, this indicates that people should not trust every information about COVID-19 that they see on the internet. Next, Arjan will talk about the consequences.
Yeah, can you hear me?
Yeah.
Yeah, so according to research, a variety of factors have been linked to vulnerability to COVID-19 disinformation and trust related to it, including vaccine misinformation. One important element is where people get the information, with research finding that people who get their virus information on social media are more likely to believe that this information is trustworthy. The rapid spread of conspiracy theories has had tremendous consequences for society. The situation with this much falsification and misinformation leads us to the point that the healthcare professional sharing appropriate information about the real effects of vaccine is ignored, while the negatively interfering fake news is considered credible and trustworthy. In addition, media is the means by which misinformation gets transmitted the most with the global society, reaching a vast variety of countries and nations in different corners of the world. Next slide, please. Not only does it prevent people from getting vaccinated, but also causes health damage. As considering vaccination not necessary and living without it, people usually overrate their immune systems, and when getting infected by COVID-19, they get serious issues with cough, fever, and sometimes it goes too far the lungs. Mostly high-aged people and also sometimes middle-aged ones take the virus really hard, and it can reach up to death. Of course, there are also cases that people have different immune systems, and they take it different way. So this all happens due to tendency of not trusting the accurate report and information done by professionals. Moreover, the effects of trust issues can reach even up to mental level. According to the studies done by National Library of Medicine in 2021, the analysis of fake news in health shows that infodemic knowledge can cause psychological disorders and panic, fear, depression, and fatigue. Also, the spread of rumors as well as conspiracies is directly related to a high increase of anxiety in people of different ages. It turns out that the vaccination may not cause side effects to individuals as much the malignant infographics and falsifications about its effects. And Ani will continue.
Thank you, Artyom. So, at the end, our group has come up with some possible solutions to remedy the situation. And after a deep research, we deducted that providing better education and understanding of the structure and function of vaccine on a personal level can be one of the most effective techniques for addressing disinformation. According to CDC, Centers of Disease Control and Prevention, one of the problematic factors of society is that human nature strives to reason and fill in the gaps when there is uncertainty about a particular topic, thus being more vulnerable to misinformation. There must be strategies for proper communication on vaccination due to filling gaps in people's perception on the vaccine. The education process involves examining the error and providing the correct information that is backed up with scientific proof. Teaching media literacy to the public is another way of struggling with fakes. Web 2.0 and user-generated content lets everyone share their ideas with the public and reach broader audiences. So it is highly probable to come across fake information. And teaching people how likely something is to be right and wrong by informing them about the misleading techniques can be the key to success in this case. Where does the information come from? What is missing? Is it reviewed by somebody else? These are the questions that people must keep in mind while dealing with social media articles. The previous slide, please. And great sources such as the fine art of baloney detection about the critical thinking can help people to be more cautious about the fakes. And finally, the level of trust in the government also plays a vital role in trusting the vaccination that it suggests to people. And to strengthen the trust even more, the leaders and influencers must talk and share their success stories. Sharing success stories can be a precious tool. According to CDC, success stories put a face to the numbers of research and evaluation data by bringing to life programs' impact to a personal level. That adds a human aspect to it and make it more trustworthy. And finally, In the end, here are some tips on how you can get protected from fake news. First of all, check how reliable the source of the claim is. Who is the author? What's the web page name? If it sounds as something unprofessional and suspicious, it probably is in reality. So stick with the reliable and official sources. Get the whole story, not just a headline. Is the headline too scandalous? That might also be a sign of fake or manipulation. Have the claims been verified by somebody else? Who else says that it is so? Does the claim correspond to the science claims? That's also important. And finally, are personal beliefs driving the claim? Is the news channel biased or it stays neutral? It may also be sponsored by someone, so be careful and double check if needed. Stay alert, be informed, not misleaded, and stay safe and healthy. Thank you.
This was it. Thank you for your attention. We hope everybody will be healthy and away from the COVID-19.